A strategy for minimizing lactate and PCO2 accumulation in CHO cell culture process. Hello, I'm Yong-Wan, head of R&D team at Samsung Biologics. Today, I would like to share our experience and expertise focusing on our strategy for minimizing lactate and PCO2 accumulation in CHO cell culture process. There have been many studies on the lactate metabolism in CHO cell culture process, and it is well known to affect significantly on the productivity and the culture longevity by growth inhibition. The lactate formation pattern can be classified into 4 different types at Samsung, as you see in this slide: ideal, saturated, go high, and re-accumulation. The ideal type is the most desirable pattern, where lactate is accumulated in the early phase and consumed during cell culture until the end of cell culture. Saturated type tends to maintain a certain level of lactate, which has the potential to definitely occur re-accumulation. In this case, an additional process study is recommended to change the pattern to lactate consumption during the cell culture. Go-high type reflects continued accumulation of lactate until the end of cell culture. In this case, it is recommended to exclude it from the early clone selection stage, considering the manufacturability. Finally, the accumulation type shows lactate formation again after some level of consumption. Some studies reported that this type was observed during process development or scale-up. This reaccumulation is one of the main reasons for less robust process. As shown in slide, a cascade impact of lactate accumulation is demonstrated. As the lactate concentration increases, the bioreactor responds feedback control through addition of base to control pH set point. As a result, osmolarity increases, which leads to a cell death due to intracellular high osmolar stress. Finally, undesired process variation, such as low productivity and quality, may come from the shortened culture duration. In my experiences, abnormal behavior of lactate metabolism has been one of critical topics. So, today I would like to share our strategy on how we resolved such problems. In this slide, you can see culture trends of Palo scale 50 liter, Cetylatron 2 liter, and Amber 15 ml development work. As you can see from the result, the major process variation comes from lactate accumulation and high osmolarity. Looking closer at the result, the viability shows sudden decrease from day 9 in 50-liter pilot scale. Lactate reaccumulation and osmolarity increase occurred after day 9. The impact of malfunction of 50-liter scale, viability was down quickly than expected, so early harvest was done at day 11, then day 14. Finally, productivity was 30% below. In order to resolve the issue, we performed additional studies by design of experiment. As shown in the table, we have selected and assessed 4 main factors such as PV, DO, glucose, and VCD at temperature shift, which might cause stress to cells. The experiment was done using 8 by 2 liter bioreactors with low and high limit of parameters. By t-test, we found the DO set point is a significant impact on the viability. This outcome shows that the oxidative stress by excessive oxygen is related to cell viability. So 30% DO rather than 50% can reduce oxygen supply in the later stage of culture. Furthermore, we analyzed the test for temperature shift, which is performed to increase cell longevity by slow cell growth. Normally, the temperature shift was set based on the culture day. However, this can result in viral cell density differences at the time of temperature shift among the viral scale and could cause process variation. Therefore, for this experiment, we set the temperature shift time based on the viral cell density rather than culture day. Then evaluated the impact at 15 million cells per mil and 20 million cells per mil. Although a statistically significant difference was not found in the test, the group with temperature shift at VCD, 15 million cells per mil, showed relatively low variation compared to the 20 million cells per mil. Summary of the experiment result. We confirmed the PV and glucose concentration had no significant impact on the viability and lactate metabolism, whereas DO set point and temperature shift viral cell density made a big impact on the process variation. Therefore, we set a control strategies in order to reduce process variation. The slide shows a summary of 2 liter, 200 liter, and 1000 liter scale, applying the control strategies set based on the troubleshooting. As you see, no process variation by lactate re-accumulation was found, and similar productivity throughout the scale was achieved. Take-home message of today's presentation. Throughout experiments, we have developed a strategy to resolve the process variation based on lactate reaccumulation and successfully completed development, scale-up, and GMP clinical drug manufacturing. We have confirmed among 4 main parameters, DO set points and temperature shift viral cell density were critical. Especially temperature should be designed based on viable cell density, considering cell growth and cell status, rather than just the cell culture day. We will continue to provide more updated advanced development to our clients for faster and better serial services. Thank you.